Coming up next on Studio 7, we've talked about. Welcome back. Obesity is a problem that has far-reaching health implications, and sometimes a surgical option can lead to great success, allowing a patient to overcome complications. In this week's Medical Center Health Systems Taking Care of You, Dr. Dawn Davenport, who specializes in bariatric surgery, joins us along with Gary Ragland, who has successfully undergone this surgery. Gentlemen, thank you so much for being here with us today. Dr. Davenport, I'm going to start with you. Bariatric surgery can be very successful, but we want to make sure people know it's not a quick, easy fix, and it requires a life change, right? So what leads to a successful procedure?
I think first and foremost, the patient has to understand that a lot of it is dedication and compliance. An understanding of what goes along with the surgery from a lifestyle and behavioral change is necessary in order to be successful long term. A lot of people do very well with diets, but that's only short term. They get off the diets and then they generally will gain their weight back. With bariatric surgery, in combination of these lifestyle and behavioral changes, they do much better. They have an assistance with the surgery to help them maintain some changes that they've not been able to do before.
Yeah. Gary, you had this surgery 2011?
2010.
2010. So we have some photographs also that we're going to be putting up as we talk. This is where you began. Tell me what led you to pursue this surgery as an end result.
I was having trouble with my back, and I'd gotten to where I could not walk for very long at a time or stand for very long at a time, and the doctor would not do the surgery at the weight that I was at, and so I debated it for about a year and then decided to go ahead and do it, and it's the best decision I've ever done.
You really smile when you say that.
Oh, absolutely.
How has your life changed?
It's just small things. I can go into a restaurant and sit in a booth and don't have to worry. I can get on a plane and don't have to worry about fitting in a seat. I can go into a regular store and buy clothes, and it's just that's just a treat after so many years of not being able to do that.
And what kind of changes did you have to make after the surgery to continue to be successful? I mean, you've got 4 years proving that this does work if you handle it the correct way.
Well, as far as what you eat, you have to, there are certain things that you cannot eat anymore. They will either make you sick or cause you to gain weight again. And lifestyle changes, of course, is being more active. One of the big things that was hard for me to give up was carbonated drinks, but that's a big no-no after the surgery, and but I've been able to do it, and I don't miss them now.
Yeah.
So,
because you like the lifestyle that you're able to lead now.
Absolutely.
And did you have any health changes, improvements after the surgery?
Oh, absolutely. I was able to have the back surgery just about 8 months after I had the bariatric surgery, and that's changed my life also. I've been able to be more active and be on my feet and do things I couldn't before. They believe in ride on a roller coaster with my daughter, something that was just a really fun thing to do.
That's so cool. And Dr. Davenport, this is your patient. I know it must bring you great pleasure to hear somebody talk about how much their life has changed.
It's pretty amazing when you work with people. In the profession that I'm in, from a surgery standpoint, a lot of times we do something and we see the patients for a very short time. They go away. With our bariatric practice, it's a lot different because we see people over and over and over again, and to see a transformation from where they were prior to surgery to just what Mr. Ragland explains about the transformation to what they can do afterwards, and realizing that a new door is open for them with regards to their life and how they're going to live it afterwards. And
are there some keys to help people succeed long term? I mean, you've kind of talked about that, but we want to really emphasize this is not a silver bullet, a magic bullet. Right.
You know, I think in society today, a lot of times we want that magic bullet that's going to fix everything. But first, I think people have to understand that the very first thing is how important is their health to them and what can they do to make it better. And stress that from the very beginning. It's not just an operation that's going to change anything, but it's a lot of lifestyle behavior changes. And it's not for the short term, but for the long term. Also, when you work with their primary care physicians and strengthen that support from a multifactorial physician perspective, it helps out tremendously. You have the support of the other physicians that say, you know what, you suffer from these problems along with the obesity, and if we can if we can improve on the obesity, these other problems will get better for you.
Yeah, and that's what I know is the inspiring part of it. Well, your story is just phenomenal. Thank you for sharing it with us today.
Thank you.
We love it. If you have questions, you can always call the hospital and the Bariatric Center, and they can get those questions answered for you. Gentlemen, thank you so much for being here with us today.
Thank you.